Good morning. Thanks for joining us again with Dr. Collin Peterson from Collin B. Peterson General Dentistry.
Thank you for having me.
Thanks for being here. So today we've talked to we've had shot a couple of segments now. So today we're talking about the patient experience, and this is really, aside from being a servant to the people, cultivating that experience so that it's not what people expect. It helps to eliminate that anxiety about going to the dentist. That's really a big piece of what you do so differently here.
Right. So one main thing that we like to emphasize, for the patient experience is the technology and utilizing the technology that we have nowadays to benefit the patient and their experience, because we don't want it to be their average experience. We want to elevate that as much as we can. So the way we do that is, one way is through intraoral scanning. So what that is, it's a new technology that has come out where we can take a lot of photos of the teeth, okay? And through that scan of the mouth, we can make pretty much anything that we want for that patient, whether it's a partial, a crown, a bridge, even a denture we can make. And we can make it at half the time of, a normal, impression. So I don't know if you remember back in the day where you get those goopy impressions and they'd run to the back of your throat. Nobody enjoys that. No. So we've eliminated that completely through the intraoral scanning. Which is a really unique and really cool process. It's even just fun to watch from a distance. So that's something that's exciting for the patient, and that's fun. And also it relieves them a little bit, because a lot of people have gag reflexes, or they have really small mouths where it's really difficult to put those trays in. It's a little more comfortable. So if we can help elevate that the best we can, then that's what we're going to do.
Well, and you know better than most how the inside of the mouth is shaped and built and designed, right? So, and when you put those large apparatuses in there so that you can put this over here to take a picture of this, like it's invariably, it will pinch something, it will scrape something. And if you have sensitive gums already,
right,
that's a problem.
Yes.
And so you're eliminating that with this device that you're just moving around the teeth.
Yeah. And like I said, it's a very small wand that we use, and just takes a bunch of pictures around the mouth. And then within a matter of seconds, we can send that directly to our lab, and they can go ahead and make whatever, apparatus that we need them to make, whether, like I said, it's a denture or crown or that sort. So
a much faster amount of time.
Much faster and much more accurate. So I have this with me. This is actually a 3D printed model that is generated from that scan. And this is way more accurate compared to the stone models that we used to have.
Right.
And, fabricated off of that. So,
and you can drop that.
Yeah.
Without having to worry about it breaking.
This is made out of composite resin. It's very strong. Like I said, it's very accurate. We can be much more precise with this technology, and we have less errors down the road, and it's much more comfortable for the patient.
When you think about just general technology as a whole in life, what we've done in the last 30 years is mind-boggling. And in dentistry, it's moved even quicker.
It really has. Within the last 5 years, we've seen dentistry just go from 0 to 60. And it's pretty amazing. Now we can 3D print just about anything, and we can do a lot of things that are in-house rather than having to send off nowadays. So that's really convenient for us and the patient, because like I said, we can do things much quicker.
Yeah, and you don't have to wait. Like, again, we discussed the whole anxiety piece, and for people, it's hard to let that go, because sometimes that stuff is like, it's deep, it's rooted, and over the course of a number of years of treatment, you can get better. Right. But it's like, I'm here, I made it here, I got here, we did the treatment. Now I got to come back in 3 weeks, so I got to do this again.
Yeah.
And we're getting closer and closer to that not being a thing anymore.
Yeah, absolutely. We're expediting that process further and further. Another thing that we also do, other than the scanning to help elevate the patient's experience, is also we have these large displays that you can see in the background, and a lot of times we'll put really calming images and videos on here just kind of distract the patient, but also we will use that as a tool to educate the patient. We can put a treatment plan on that screen, we can put their x-rays on there, and we can really dial in, and they can see a visual explanation of what is actually going on. And that helps with their anxiety, because if they can see it physically of what they need done, they're much more at ease when they can understand it, rather than just, believe and take our word for it.
And you can show like pictures of the teeth.
Absolutely.
And it hits home a little more when you can actually see, because I've sat in chairs before and dentists have told me what they see, but when you can tell me what you see and then you can show me at the same time,
right,
that makes me want to care for my teeth a little more, because that's, for me, that's skin in the game. Like, oh, I can see what I'm not doing now.
Right. And we can show them that cavity, and we can show them how big that cavity is or how small that cavity is. And we can show them so many different things about their treatment that needs to be done. And once they leave that room, they have a much better understanding and the importance of what they need. So it really helps, their treatment and their care overall.
Sure. We got a couple minutes left. Vibration anesthesia and the services you offer.
Yes.
Let's go over that really quick.
Yes. So vibration anesthesia, what that is we will use vibration as a therapy while we're doing our injections. And what that does is it distracts the body from the pain receptors involved during the injection. So we replace
the body and the brain.
We are tricking the body and the brain, essentially. Basically, we're putting that vibration in another area of the mouth, and while we're injecting, and they don't even feel the anesthesia because of the vibration. And it's a really interesting method that we use, and it also helps alleviate and brings down the anxiety as well. So,
services. What can we expect here? What can you do?
So we do really everything. We are a general dentist office. We do crowns, bridges, partials, veneers, dentures, fillings, extractions, you name it, we do it.
All ages?
All ages. We see, anyone from, under 1 year old all the way to 100. So we really do a little bit of everything. That's one of the reasons I pursued general dentistry, is I love the variety of things. So we really try to emphasize that here.
And, I have a 3-year-old. If they've got teeth, they should be seeing the dentist.
Yes.
And so it helps to start at that early age, where those preconceived notions of what happens or things they've seen on TV aren't really a factor. You can eliminate that.
Yes, because the earlier you bring your child into the dentist, the quicker they are going to familiarize themselves at a dental office. If they come in here 1, 2 years old, or even later down the road, if they've never experienced what the dentist is, they're automatically going to have a fear, because it's always a fear of unknown. But if they are established and incorporated at a young age, then they can grow into that, and they have much less of a chance creating that dental anxiety that a lot of people have.
There you have it. If you're looking for a new experience, if you don't have a dentist, if you just moved to the area and you're looking for a new dentist office, listen, D'Amberville, right here by I-10, close to the Pizza Hut. You can't miss it. It's a brand new building. It's absolutely gorgeous. Call that number you see on your screen. Check out that website, and they will get you started to that dental care. Thank you so much, Dr. Peterson.
Thank you for having me.